Welcome back to the AOFAS annual meeting hybrid experience. I'm your host, Raisa Pascal, and even though we would have loved to see you in Charlotte this year, I want to thank you for still making the decision to be with us virtually. We're officially at the halfway point for the annual meeting, but the education, networking, and learning has yet to slow down thanks to an extensive offering of scientific sessions. Can you introduce yourself to us? Tell us where you're joining us from.
My name is Zachariah. I go by Zach. Originally from Pittsburgh, Pennsylvania, and I just relocated back there for work, and which I'm excited about. Be closer to family, my wife and I with children. Yeah.
Lovely. Is this your first time at the AOFAS annual meeting?
The full meeting. I've gone to specialty days, part of the other the annual academic orthopedic conference. So it's my first time. For the full foot and ankle society.
Well, as a first timer, I have to ask, what are your thoughts? Tell me what you've been able to enjoy so far.
Yeah, very impressive. I've done some Zoom things in the past, but in terms of physical, I always enjoyed physically attending. That's kind of take things educationally a little better, I guess, that way in terms of how I obtain or understand or learn things. And so it's been great, impressive lectures and great topics. That are very pertinent.
That's good. And then as far as the lectures, those topics, can you speak maybe to the quality of the speakers that you think AOFAS has brought out to the show?
Yeah, absolutely. Extremely well experienced and well publicized in terms of all these instructors or professors, part of big academic institutions, universities, which I've known personally just from my own training and education, and so certainly no surprise to the quality, and overall very impressive and well-rounded.
Excellent. I'll ask you one more, just kind of looking ahead the rest of this week. What are you looking forward to the most? What do you want to take away? Any technology maybe on the show floor or specific information from your sessions? Just talk about kind of what you're hoping to get out of this meeting.
Always all the above, certainly depending on your own experience in terms of speaking for myself, you'd like to pick up little tidbits, pearls, so to speak. Obviously, new technology, surgical aspects that you didn't either think of or maybe you tried in the past but haven't revisited. And so, absolutely, all the above. There's always little things to take away in all regards, and it hasn't been a letdown in that aspect.
We're happy to hear that, Zach. Thank you for joining us, and we hope you enjoy the rest of the conference.
Thank you for your time. Appreciate it.
Can you introduce yourself to us? Tell us your name, where you're joining us from, and what you do.
So I'm Sarah Anderson. I'm a foot and ankle surgeon in St. Paul, Minnesota at Regents Hospital.
Excellent. Okay, Sarah, is this your first time at the AOFAS annual meeting?
Probably my 14th.
14.
Something like that.
Oh my goodness. Okay, so clearly there's something about this meeting that keeps you coming back. Talk to me about what you get out of being here.
So I think new ideas. You get to hear smart people talk about their experiences and remember things that you forgot about already in your practice. And I think it's an interesting opportunity just to be surrounded by people who love foot and ankle.
So as a veteran of this meeting, you're aware that obviously last year was very different to how we usually have it. How does it feel to kind of be back together, face-to-face, meeting with your peers in person? I mean, that's a nice feeling. Talk about being back together.
I think it's really great. I've already met up with 2 different people. I've got 2 more plans to meet up with other people. And I think it's something about the vibe in the room, and then when you're chatting afterwards is something that you can't catch on Zoom.
I like that. And have you been able to see the exhibit hall at all?
I have not been there yet.
Okay, not yet. She says yet, so she is going to head there eventually. I'll ask you one more then. Just kind of looking ahead to the rest of this week, what are you looking forward to most?
I think just all the general symposia and meeting up with a new colleague who's joining our group in the cities, and looking forward to the future of foot and ankle.
Well, we hope you enjoy your time here. Thanks for speaking with us.
Thank you.
Can you introduce yourself to us? Tell us your name, where you're joining us from, and what you do.
Yeah, I'm Michael Lee. I'm an orthopedic surgeon, foot and ankle specialist in Spartanburg, South Carolina.
South Carolina, okay. And is this your first time at AOFAS?
As a non-trainee, yes. So I was a resident and a fellow, have been to the meetings, and now as a practicing physician, this is my first time coming.
Nice. So how does that feel, kind of having come up through the ranks and, finally here as, attendee, as you said, and just share that feeling?
Yeah, it's exciting. The whole process is great when you train, you learn, and now, it's a continuing education process as you come back for more.
Absolutely. And what are you most looking forward to getting out of your time here?
Just the continuation education process. You learn more and you just expand your knowledge base, and you more or less keep up with the current techniques and processes so you make sure that you do right by your patient.
Nice. And have you had a chance to see the exhibit hall yet?
Yes, I have.
Okay, well, then you know what's coming up next. I have to ask you what you thought about the exhibit hall.
I thought all the booths were great. They had great product lines. They had a good spread, and all the reps around there were very nice and cordial.
Very good. Thank you for your time.
Yep, thank you.
Can you introduce yourself to us? Tell us your name and where you're joining us from and what you do.
Yes, I'm Chris Testerman. I'm from Knoxville Orthopedic Clinic in Knoxville, Tennessee.
Very good. And how long have you been in practice for?
24 years.
24 years. So this is not your first time at AOFAS. Tell me what keeps you coming back.
I really like the scientific papers, and we just had the small group sessions that were very informative and sharing little tidbits about cases that help constant correction and improving on the correction and improving on the patient and surgeries. It's been really interesting.
Nice. And we have a lot of education here. Can you kind of speak to the quality of the speakers and just the value that you get from an education standpoint?
Right. So I like the way they've combined new and experienced residents, fellows, and attendings, and it's been, and patients and physicians in private practice. It just gives a nice perspective on what the newer techniques are, and also people that have used the older techniques and how they've been able to improve on their practice combining both of them. And also the innovative labs have been really good too, where they do actually cadaver labs.
Yes. And speaking of innovation, have you been able to see the exhibit hall?
No, not yet.
Not yet. She'll head there eventually, just not yet.
I will. Thank you.
All right. And if I can ask, just kind of looking ahead to this week, what are you most looking forward to getting out of your time here?
I've already picked up some ideas that I think will help in the surgical treatment of patients. Plus, it's good to interface again with colleagues that I trained with, and yeah, just a good experience overall for continuing education.
Well, thank you for your time. We hope you enjoy the remainder of your time here at the conference.
Thank you.
Can you introduce yourself to us? Tell us what you do, your name, and where you're from.
Sure, I'm Paul Toulousan from the University of Michigan, foot and ankle surgeon.
Excellent. And is this your first time at the AOFAS annual meeting?
No, this is like my 6th or 7th, I think.
Nice. We're having a hard time finding a lot of first-timers. So what keeps you coming back?
It's a combination of things. I mean, I think seeing all my old friends, making new friends, and then learning a lot.
And speaking of learning, there's a lot of education. You're about to head into one right now. Could you talk about some sessions you've been able to sit in on, what you learned, what you're taking away?
Sure, I think I've been to most sessions, and learning new surgical techniques, always learning new things about anatomy. So yeah, learning never stops.
Very good. And just a couple more. Have you been to the exhibit hall yet?
I have been to the exhibit hall.
Tell me what you thought, the new technology offerings, the quality of the exhibitors we have here.
Oh, it was great. It was great. I mean, a lot of people I've already known, so it's nice to catch up with some of the old friends from industry and make new friends and learn about new stuff and products.
And lastly, just have to ask, what are you most looking forward to getting out of your time here?
Again, I think it's just the relationships, and then just picking up little things and taking them to the operating room and trying out new stuff.
Well, we hope you find it valuable, and thank you for your time.
Thanks.
Can you introduce yourself to us? Tell us your name and where you're joining us from.
Sure. My name is Amanda Fantree, and I live in Hartford, Connecticut, and work as clinical associate faculty at UConn.
Excellent. And is this your first time at the AOFAS annual meeting?
No, this is my 5th time.
Love it. We love people who come back. So tell me what keeps you coming back.
Sure. So I think AOFAS is a great opportunity to learn, to refresh yourself on some concepts, to learn about interesting and hard cases, and to network with friends, colleagues, people you haven't seen from residency or fellowship, or just meet new people.
I love that you touched on the networking because it's so great to be able to do that in person, to be face to face with each other. How does that feel for you, just to be back after this pandemic?
It's been really nice. I mean, I think I have just really enjoyed the opportunity to even do simple things. I get on a plane, I can go to the airport, I can meet here and, see friends and colleagues who I haven't seen in a long time, and, connect about our jobs and work and life that you haven't done in 2 years.
You mentioned education earlier, so you've been able to sit in on some education sessions. Can you kind of share some things you're learning, what you're taking away?
Yeah, so I actually just came back right now for this symposia on talus OCDs, and there's some really great topics at throughout the symposia over the next couple of days, and I'm really excited about them because it's always nice to see what's like on the forefront and what people are doing.
Sure. And then speaking of what's on the forefront, kind of innovation, technology, have you been able to check out the exhibit hall?
I have not been there yet, but I am going.
Okay. You're going. I'm going to hold you to that, okay? All right. I'll ask you one more. We're kind of here halfway point of the meeting. What are you looking forward to getting out of the remainder of your time here?
So I think the Women's Leadership Program tonight is something I'm really looking forward to and should be a great time. I'm moderating a trauma session in a couple days, so I think the rest of the meeting should be pretty great.
Can we get the little plug for your trauma session? Can you tell us the time and what you're going to be speaking about, and the title of your session?
Sure. So I'm moderating a trauma session on Saturday morning at 8. It's upstairs in one of the rooms. We have some great speakers.
Excellent. Well, thank you for your time, and thanks for being here.
Thank you so much. This was great.
Can you introduce yourself to us? Tell us your name and where you're from and what you do.
Lyle Jackson. I'm from Eugene, Oregon, and I'm a foot and ankle surgeon.
That's right. That's pretty popular here. And how many times have you been to the AOFAS annual meeting?
Oh, I mean, probably 5 or 6 now, I'd say.
So tell me, what keeps you coming back? What is it about this meeting that makes it valuable for you personally to be here?
Mostly the chance to learn and then just reconnect with colleagues from around the country. I mean, it's nice to be able to see people again. We obviously took a couple of years off, and so it's good to be able to do that in person again.
Nice. And have you had an opportunity to see the exhibit hall yet?
Yes.
Nice. So tell me kind of your impression of the quality of exhibitors, the technology you saw out there, if there was anything you were looking for.
Oh, I mean, I think you're always just sort of looking for either new things to enhance your practice. You have to sort of take everything a little bit with a grain of salt as you're trying to evaluate it and what sort of sales pitch you're going to get along the way.
That is true. And then kind of coming back to education, is there anything that you've already kind of set in on that you're taking back home with you? Any kind of tidbits you can share?
Oh, I mean, gosh, lots of tidbits. I think, just sort of the first symposium presentation this morning on thinking about either total talus implants or other kind of emerging technology with 3D printed things is exciting stuff for the future. Things to consider cautiously.
Very sad. Very good. Thank you. Well, we appreciate your time here and hope you enjoy the rest of the conference.
Right, thank you.
Can you introduce yourself to us? Tell us your name, where you're from, and what you do.
My name is Dr. Lance Silverman. I'm an orthopedic surgeon from Minneapolis, Minnesota.
Excellent. And how many times have you been to the annual meeting?
Almost every time with the exception of July of 2000 when I got engaged and I got married during that same week, and I couldn't come to the meeting. So since then, every single time.
Okay. I think that's a good excuse. That's a good reason to not come. So tell us what keeps you coming back.
A lot of the connections, meeting friends that I've made over the years, getting new pieces of information, learning about new techniques and new products, and really kind of getting that camaraderie of really learning how to get better and become a better surgeon.
Very good. And have you been able to see the exhibit hall?
I have.
Okay, so I have to ask you, what are your thoughts, the quality of the exhibitors, the technology out there?
Well, I'm a little biased because I am a consultant for Osteo, and they have the coolest NASCAR downstairs. And there's some really interesting products down there that I'm really excited to try as I get back and let my patients know how much better I can do for them.
We're excited to have you here. Thank you for your time.
Thank you.